Hello and welcome to my channel. My name is Olga Sirbu and I am a board certified behavior analyst and licensed behavior analyst. In this video, I'll be discussing what is autism, how it's diagnosed, and what are the current treatments and therapies. But before we get started, please make sure to hit the subscribe button below so that you don't miss out on any of the valuable information I'll be sharing in my weekly videos. So, what is autism? Autism is a complex developmental disorder that affects millions of people worldwide. It's a neurodevelopmental disorder that affects social interaction, communication, and behavior. Autism affects the brain's development and the way it processes information. It is a spectrum disorder, meaning that it affects each individual differently, and that is the reason that the symptoms vary from person to person. Despite that, 5 of the most common autism symptoms are difficulty with social interaction. People with autism may struggle to make and maintain eye contact, initiate and maintain a conversation, share emotion and interests with others, understand social cue, and make friends. Second, communication difficulties. People with autism may have difficulty communicating their needs and wants effectively. Their speech can be delayed or absent. They do not use pointing as a form of requesting, and they may use repetitive language or have trouble with nonverbal communication. Third, repetitive behaviors. People with autism may engage in repetitive behaviors such as hand flapping, rocking, repeat the same words and sentences. We may see an unusual interaction with toys, such as aligning toys or watching tires spin. People with autism may demonstrate inflexibility with transitions and changes, develop rituals by doing the same things every day, eating the same food, and playing with the same toys. They may also have restricted interests, such as focusing on one topic or activity for a long period. 4. Sensory processing difficulties. People with autism may have difficulty processing sensory information, such as sounds, smells, or textures. They may express aversiveness to specific sounds or texture. Also, they may engage in excessive smelling or touching objects and be fascinated by light or movement such as flashlights or spinning tops. Fifth and last, delayed motor skills. People with autism may experience difficulties with gross and fine motor skills. They may look clumsy and have trouble sustaining their balance. Of course, there are many more symptoms as they differ from person to person, as we mentioned earlier. The best course of action if you suspect that your child has autism is to have an exam by a medical professional such as a neurologist or psychiatrist. They are the ones that can perform a diagnosis. A diagnosis is typically based on a combination of factors, including child's developmental history, behavior, and communication skills. There is no single test for autism, but doctors may use tools such as the Autism Diagnostic Observation Schedule or the Autism Diagnostic Interview Device. Unfortunately, there is no cure for autism. However, there are various treatments and therapies available to help manage the symptoms. Some of the most common are behavioral therapy. This type of therapy focuses on changing behavior patterns through reinforcement and conditioning. Its main goal is to teach social and communicational skills, as well as reduce repetitive or maladaptive behaviors. Additionally, it can help children with autism learn how to cope with challenging situations or emotions. Speech therapy. This type of therapy focuses on improving communicational skills such as language, pronunciation, and conversation. Typically, it involves a variety of techniques and activities that are tailored to the child's individual needs and abilities. Occupational therapy. This type of therapy helps individuals develop or improve the skills needed for everyday's life activity, such as dressing, eating, and playing. For children with autism, occupational therapists can help them improve their fine motor skills, sensory processing, and daily living skills. Last, medications. Despite the fact that there are no medications specifically for autism, some medication may help manage symptoms such as anxiety, depression, or aggression. If you suspect that you or a loved one may have autism, it is important to seek the advice of a medical professional. With proper diagnosis and treatment, people with autism can live fulfilling and happy lives. I hope this video provided you with a better understanding about what is autism, its characteristics, and treatments. If you have any questions, please type them in the comments below. Thank you for watching. I'll see you in the next video.